Hi guys, how you all doing? You're welcome to my page. This is Ivy Queen, which you all know as Nurse Amounting. Today we're gonna be addressing some stuff about we don't even know, we don't notice, but I will address it in the two language. Go to the you that I'm not worried, I'm not panic. I'm here for you guys. Today we'll be addressing high blood pressure, which is known as hypertension. What is this high blood pressure? It happens like ma explain it before my you just chill. It happens when there is a force and the blood pushing against the blood vessel is too high. Emma, we cannot do with it. Let's take a look at this example. Let's assume now that you are pumping a water in a tank, and the hose you're using to pump the water, like there is a force where it's too high. And we tó bá ti high jù tó ṣe ń sáré rush yẹn tó mi ṣe ń sáré rush wọnú hose yẹn ó lè bẹ̀ one ó dẹ̀ lè fa pé kó weak, so it might burst or weaken the hose or the strength. So that's what happens in her body, whereby the blood that is pushing into the blood vessel tó bá ti high jù ó lè fa wípé kí àwọn iṣan tó ń gbé ẹ̀jẹ̀ kọjá yẹn kó wíìkì tàbí kán bẹ́. Nǹkan tó máa ń ṣẹlẹ̀ tó máa fi di wípé wọ́n ní ìfúnpá gíga nìyẹn, which is high blood pressure. And mama ṣe I'll be addressing the causes, the symptoms, and how we can take care of ourselves, because I know most people don't even know about this thing, and this thing is known as silent killer. And do you know the funny part is that this hypertension is even most causes, like it's most common rather in African, because identical to our Ninja we don't check our high blood pressure, we don't even take care of our health or something like that. You see most of people whereby they just wake up in the next day and they'll be like, and you shall I see you can you be like, kilo she like this thing is known as silently killer. You won't even notice, for real. You won't notice because you don't check your high blood pressure, you don't check your blood pressure, you don't check your diabetes, you don't check your anything. So you won't notice that this thing is affecting you. So let me talk about the causes now. The first causes is stress. Like you work now, it might cause high blood pressure. The second one is on eating unhealthy food. I like it, I like it, junks. Party junk system. Àwọn mìíràn tó jẹ́ pé wọ́n like wọ́n máa jẹ ìsebẹ̀ mọ̀ pé tí a bá ń jẹ ìsebẹ̀ púpọ̀ jù ó máa ń fa high blood pressure tó jẹ́ wípé ó máa ń affect àwọn iṣan kan ní ara wa tí ìsebẹ̀ bá ti pọ̀ jù. Yeah. Tẹ́ bá lọ sí outside country nígbà míì lè máa gbọ́dọ̀ sọ pé àwọn Africa àwọn jókòó sẹ́gbẹ̀ẹ́ wa skin wa run something like that, but I'm not going there, I'm not addressing there now, I'm addressing high blood pressure, which is known as hypertension. Èyí tá a mọ̀ sí ẹ̀jẹ̀ ríru. Tá a bá jẹ́ nìkan tó wípé a máa ń jẹ ìsebẹ̀ jù tó bá fi ìsebẹ̀ little salt is enough for a food, whereby àwọn míì wọ́n tó bá ń jẹun báyìí wọ́n á ní àkíyèsí òdùn oúnjẹ kí ló dé tó ń jẹ yìí tẹ́lẹ̀ nù báyìí ẹ bá ń gbèsè bẹ̀yìn ọmọ ẹ bá ń gbèsè bẹ̀yìn kíní kan, and wọ́n á mú ìsebẹ̀ bí tó jẹ́ pé, and that is not good for our health. So let's limit our intake of salt, because excess salt is not good for our health. And the third one is lack of exercise, rather lack of exercise. Tí a bá jẹ́ nìkan tó jẹ́ pé a kì í ṣe exercise, tá a bá jí láàárọ̀, at least tá a bá jí láàárọ̀ jẹ́ ká lè na ara wa, ká lè sáré díẹ̀, tá a bá lè sáré díẹ̀, ká lè ṣe àwọn stretches kọ̀ọ̀kan tó jẹ́ wípé it's gonna make our body feel good. A kò jẹ́ pé a máa jí báyìí gbogbo àwọn jẹ́kùjẹ́ tá à ń jẹ yẹn náà, tá a bá ti jí báyìí a lọ fọnú báyìí àti máa jókòó ibi tá a ti jókòó tá a ti jí yẹn náà láti máa jẹun. Like lack of exercise might cause this thing. And we have genetic, which is in your family background, this thing, the hereditary might be like that here. Èyí tó wá ṣe ìkẹyìn ẹ̀ òun ni wípé ká máa mú gbó, you know, smoking cause high blood pressure, which is known as hypertension. Smoking, like àwọn tó bá mú gbó wọ́n máa sábà ń pọ̀ ní àárín wọn. So let's reduce this smoking because it's not good for our health. Now àwọn àpẹẹrẹ tá a máa rí tá a bá ní ẹ̀jẹ̀ ríru yìí, àkọ́kọ́ òun ni wípé you'll be having headache. Yeah, you feel like kí ló dé torí wá ń fọ́ mi, ṣé wàá rí orí fífọ́ yẹn kò ní wá jẹ́ ọ̀sán o àbí alẹ́ o, ẹ máa notice wípé àárọ̀ lè máa sábà ní orí fífọ́ ìbí àtẹ bá ṣe jí báyìí ẹ máa sùn ẹ máa jí ẹ máa máa gbà ṣé bí mo ṣe jí ni kí ló dé tó rí tí wọ́n ń fún mi báyìí. I just woke up, what's wrong with me? Like I slept very well, I slept 8 hours, what's going on? It's high blood pressure, my dear. So ẹ jẹ́ ká máa yẹ ìfúnpá wa wò lóòrèkóòrè because most of these symptoms is headache, especially in the morning. The second one is dizziness. Tẹ́ bá ṣe jí, tẹ́ bá rí pé òyì ń ká yín or you feel like a headache, you just stand up like this. Ara yín kò fúyẹ́, like you wanna fall down. You feel so báwo máa ṣe pé náà so light, like which is hypertension. Do you know this hypertension? The other name is silent killer because you won't even notice. There are some people that won't even notice all the symptoms I'm saying. They won't, like seriously. So let's take care of ourselves. The fourth one is blood vision. Tó bá jẹ́ pé òyì máa ń sábà ń ká wa àbí gbogbo ẹ̀kọ́ máa ń dédé ojú máa ṣú, like you won't see very clear blood vision. This is one of the most causes of hypertension. And we have chest pain. Kaya máa dùn wá, you just notice that you feel pain in your chest, like everything is kind of tight, you feel pain. And the next one, you won't be able to breathe in and down very well. Like tẹ́ bá fẹ́ mí báyìí á dàbí pé atẹ́gùn yẹn wọ́n kó kúrò nínú yín, ẹ máa mí lọ sókè mí lọ sílẹ̀, kò ní já sókè. This is one of the best thing. And most cases àwọn míì máa sábà ní nose bleeding because mo ṣe sọ fún yín pé kini is known as silent killer for real. Wọ́n máa ní nose bleeding, like athletics, they'll have it but they won't even notice that this thing. So let's take care of our health, guys. If you're experiencing all these things I just mentioned, go to your nearby hospital, check your blood pressure, your sugar level, like all these things. They should be like ó jẹ́ ká máa ṣe lóòrèkóòrè. Tó bá tiẹ̀ jẹ́ pé a lè ṣe lóòrèkóòrè, ẹ̀ẹ̀kan láàárín ọ̀sẹ̀ ó dáa gidigidi láti máa yẹ ìfúnpá wa wò, which is the high blood pressure, and check your blood level. And if you're experiencing all this kind of stuff, go to your nurse or doctor or nearby hospital, tell them all these things, because if not being taken care of, it might lead to other risks, something, and it's gonna damage our health, and it might even lead to medical emergency. Yeah. So well, let me just give you a clue whereby you can stop. Like if you're experiencing this kind of thing, a clue you can just put in, and it's going to reduce salt intake. Ẹ jẹ́ ká rọra máa jẹ ìsebẹ̀ tá bá ń jẹ, tó bá jẹ́ pé ó máa ń pọ̀ jù, àwa tá láìkí ká máa jẹ ìsebẹ̀ gidi gan, kò dáa fára wa. Ìsebẹ̀ kò dáa fára wa. Tó bá pọ̀ jù gan, you will see that you'll be smelling. For real. I'm not exaggerating anything here. If salt is too much in your body, you cannot be smelling. So the next one is do exercise regularly. Ẹ jẹ́ ká máa ṣe kí làwọn Yorùbá máa ń gbé náà, ẹ jẹ́ ká máa ṣe exercise lóòrèkóòrè, because this thing like you exercising your body is very ó dàbí pé ká máa fún àgọ́ ara wa lóúnjẹ ní tá bá exercise. Must not be too much and must not be too much, and you have to do it also. Kò ń ṣe nǹkan tó jẹ́ pé àgbọ́dọ̀ má ṣe àti àgbọ́dọ̀ má ṣe. I don't know that, ẹ má mi ní ẹ̀fọ́jú. And which one will I say now? And if you're a kind of person that do smoke, please reduce it. And even if you can stop it, just stop it. Stay away from it. Yeah, and rest. Rest a little bit, exercise. Rest a little bit, exercise. So you guys stay safe and be good. Ọlọ́run aláàbò ní fi kò ní káàbọ̀ kúrò lórí wa, kò dẹ̀ ní fi àgọ́ ara wa, kò ní fi dè wá mọ́lẹ̀. You guys stay safe. It's Nurse Emmanuel. Don't worry, in my next class I'll be talking about low blood pressure, because I said it now, you can understand me. I said high blood pressure. There's differences between high blood pressure and low blood pressure. So you guys stay active. Next class we're gonna be talking about that. See you all. Take care.